So tell me about the position that you hold as the Richard Dimbleby Chair of Cancer Research.
So I've been in my position since beginning 2005, and the task that I gave myself was to set up a unique department of cancer research within the UK that's comprised of people from different expertise areas. For example, Simon is representing physics. I myself have a medical background.
And what's it been like working with Dimbleby Cancer Care in this project?
We've been quite fortunate to have been funded by the Dimbleby Cancer Care and also other charities as well. What I find very unique about DCC is that it's primarily run by a family. It has a personal touch, and it really cares about what the researchers do, and we have a very close link to the whole family. And the other unique thing about Dimbleby Cancer Care is it spans the entire cancer journey.
Yeah.
So from what we do, which is cancer drug discovery and personalizing medicine, all the way to the palliative care aspect, alternative medicine, palliative care, making sure people are comfortable.
And can we get into the specifics a little bit about what you're researching, what goes on around us here?
The task we've given ourselves, one of the main tasks we've given ourselves, is to be able to devise medical diagnostic method that can tell us, or tell the clinicians, the oncologists looking after patients, which are the 25% of patients that should benefit from this drug.
And these are long-term objectives, aren't they? What sort of things will you actually be doing on a daily, day-to-day basis?
Now we got to a stage where we think we have enough experience to really tackle the real human tumors coming from clinic, coming from pathology laboratory, and devise tests that can directly inform on whether or not these patients will respond to treatment.
Yeah, and can you show us anything here?
Yeah, I think, since we have Simon here, so this is a sort of typical tumor sample that contain around 80 patient samples on it.
Okay.
So these are the little spots, and you can also see it on the screen as well. And I'll just leave it with Simon to kind of give you a short demonstration of how this technology
brilliant, that would be good.
So what we have here is an automated microscope system which will basically pick out each one of these little tissue samples, perform an optical analysis on it, several optical analyses on it, and derive sort of really high density information that we can then drill into and inform us of the molecular environment of the cell. Yeah. And in fact how that's changed or progressed as a function of cancer, as Tony was describing. So quite simply we define these areas of interest by just with a clinician looking at these different tissue samples, picking out regions which they define as cancerous or benign or whatever, and then probe those using this microscope.
And this research that we're talking about, how does that actually affect the lives of cancer patients?
Well, I think the long-term goal would be to use this as a diagnostic tool, or at least as a prognostic tool.
What sort of time period are we talking about?
Well, I think if you look at Herceptin and other related compounds that are coming through the pipeline, the prediction in the drug discovery field is that within the next 10 years, all the newly approved drugs will have to have what they call a molecular diagnostic method accompanying the new drug. So they will only approve drugs, I think, in the future. I think we'll see in the next 10 years that unless you have a test that come with it, that tell you which patient might benefit from it, it simply won't go through the market.
If research is successful, what would it allow you to do in relation to patients' treatment?
Well, there's a huge benefit in knowing the patient at an individual level. So this is about personalizing medicine. And we can see that if that patient as an individual going to respond at the cancer molecular profile level, and if that patient does respond within a very short period of time, we should be able to make a decision to either continue that treatment or perhaps to switch treatment to another molecular target or combine treatment.
Have you had the opportunity to hear what some cancer patients think of this?
In many ways, I think patients and patient family who donate to the charity really have faith and confidence that kind of research that go on, like in this laboratory and others, are generally going to improve things in the time to come.
So within the next decade, we could see results of work that you're doing here actually affecting the daily lives of people who are living with cancer?
I sincerely hope so.